Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Nitrates. In the nitrates, first pharmacokinetics of nitrates. So, pharmacokinetics of nitrates. The nitrates are well absorbed orally. You can give them orally. These nitrates are actually lipophilic drugs and they are non-ionic drugs, so they are well absorbed orally. But the main feature is they are explosive, and these nitrates have high first pass metabolism. See, because though they are absorbed well orally, because of their high pass metabolism, they are given as sublingual route. The sublingual route will help in bypassing the first pass metabolism, because when they put the nitrate tablet below the tongue, it gets absorbed into the blood vessels present in the tongue and directly it goes into the systemic circulation, thus avoiding the first pass metabolism in the liver. Among the nitrates, the glycerol trinitrate. This this glycerol trinitrate, this is given sublingually. And when you give this glycerol trinitrate sublingually, in such cases the action will start within 5 minutes itself. Then we have isosorbide mononitrate. Isosorbide mononitrate is least permeable. It is least metabolized. And because it is least metabolized, so it has highest availability. So this has 100% absorption is given, that is isosorbide mononitrate. So because of this 100% absorption, this is the longest acting nitrate is isosorbide mononitrate. So isosorbide mononitrate is least metabolized, it has highest available. That means it shows 100% absorption and it is the longest acting drug among the nitrates. So then all the nitrates are metabolized by an enzyme called as nitrate reductase. So longest acting is isosorbide dinitrate. Then what is the shortest acting nitrate? Shortest acting nitrate is amyl nitrate, and it has a half life of less than 1 minute, and this is given by an inhalational route. So these are the important points about pharmacokinetics of nitrates.
thank you and thank you for watching.